Welcome to MD Anderson. The goal of this video is to help answer your questions about chemotherapy, or chemo. In this video, you learn what to expect and how to manage potential side effects. You will also learn what resources are available to help you and your family cope. This video is a supplement to the Chemotherapy Guide. The guide has more detailed information which you can quickly find. Chemotherapy refers to medicines used to treat cancer. Cancer cells are not normal in that they divide or grow very fast. Cancer-fighting medicines work to kill cancer cells of the main tumor. They also target cancer cells that have metastasized. This means the cancer has spread to lymph nodes and other parts of the body far away from the original tumor. Since chemotherapy affects all rapidly growing cells in the body, this also includes normal, fast-growing, healthy cells. Chemotherapy is available in different forms. You may receive it as an injection or infusion into an artery or vein, a pill or capsule taken by mouth, cream or ointment to be applied to your skin. You may receive chemotherapy while in the hospital or as an outpatient in one of the ambulatory treatment centers or ATC. Your treatment plan depends on your diagnosis. Chemotherapy is given in cycles. Your first day of chemotherapy is day 1 of the treatment cycle. You will receive chemo for 1 or more days during each cycle. The days without treatment are called rest days. The time between your first day of chemotherapy and your last rest day is 1 cycle. Lab work may be done often during each cycle to watch for side effects. If you're receiving oral chemotherapy, it may be considered a specialty medicine. This means you may need to pick it up from a different pharmacy, or it may be mailed to you. It's important to tell your healthcare team when you receive your pills or tablets. Let them know if you do not receive or have any problems getting your medicines. A delay in receiving and starting your chemotherapy may lead to a change in future appointment times. Your healthcare team will help you with this process. Chemotherapy affects every person differently. Chemo may affect you differently with each cycle. The most important things to remember are to pay attention to your body, keep a list of side effects you experience, and report them to your healthcare team. Most side effects can be managed with medicine or other treatments. Most chemotherapy treats cancer by killing cancer cells, which are fast-growing cells. For this reason, side effects may occur. Your blood cell count may go down after chemotherapy begins. Low blood counts may cause you to be pale, feel tired, become short of breath, and bruise or bleed more easily than usual. These symptoms can be treated. Tell your healthcare team about any you may have. Red blood cells help carry oxygen throughout your body. Platelets help your blood clot if you injure yourself. Your red blood cell and platelet counts may also decrease during chemotherapy. Depending on the type of chemotherapy regimen you're on, your healthcare team may monitor your blood counts throughout your chemotherapy cycle. Tell your healthcare team if you notice any bleeding, bruising for no apparent reason, severe fatigue, or shortness of breath. White blood cells protect your body against infections. Depending on the type of chemotherapy you receive and your treatment schedule, your white blood cell count may drop. When your white blood cell count is at its lowest, you are most at risk of infections. For chemotherapy treatments given every 3 weeks, your white blood cell count is at its lowest between day 7 and day 14. Other treatment schedules, such as weekly, may affect your white blood cell count differently. Talk with your healthcare team to find out when your white blood cell counts will be low so you can protect yourself from infections. Throughout your chemotherapy treatment, your healthcare team monitors your blood counts with routine blood tests. If blood counts are low, you may be more likely to get an infection. Protect yourself by following these guidelines. Do not use suppositories. Avoid activities that might cause injury. Do not take aspirin or other pain relievers without your healthcare team's permission. Tell your healthcare team about any vitamins or herbal supplements you take. Dietary supplements may not mix well with your chemotherapy treatment. To help prevent infection or disease, wash your hands often with soap and water for at least 20 seconds. Avoid crowds and people who you know are sick. Avoid getting cuts or breaks in your skin, and talk with your healthcare team before you get any vaccines. Practice good mouth care and bathe daily. Take your temperature as instructed. For a fever of 100.4 degrees Fahrenheit, 38 degrees Celsius, call your center to determine if you need to seek urgent care. If your call is not answered, go to the nearest hospital emergency center. Your healthcare team may give you other temperature guidelines. Take your temperature every day and when you do not feel well. During chemotherapy, you may experience fatigue, meaning you may feel physically or mentally tired. Follow these tips to help manage fatigue. Prioritize your activities so that you complete the most important tasks of the day when you have the most energy, and let others help you get things done. Balance rest with activities, making sure you don't spend the whole day in bed. Exercise. Take short walks or do some other physical activity. Just be sure to discuss your exercise with your healthcare team. Exercise can boost your energy level, along with a balanced diet. Nutrition plays an important role in fatigue. If your body is not getting enough calories, it essentially doesn't have enough energy for you to do activities of daily living, such as walking, washing your hair, doing things that you do every day. Eat a balanced diet. This can be 3 good-sized meals or 6 smaller meals a day. Drink 8 to 12 glasses or 2 to 3 liters of non-alcoholic, mostly non-caffeinated fluids each day. You can also drink fortified nutrition beverages between meals. Fatigue may get worse throughout your chemotherapy treatment. Be sure to tell your healthcare team if your fatigue does not get better or if you are so fatigued that you stay in bed more than half the day. You may need a referral to MD Anderson's Fatigue Clinic for help. Chemotherapy may cause side effects in the digestive tract, such as nausea, vomiting, diarrhea, or constipation. Many chemotherapy medicines cause nausea and/or vomiting within 24 hours of treatment. This could last for a few days. Prescription medicines and dietary changes may prevent or control nausea and vomiting. Be sure to talk with your healthcare team about these medicines. When you feel nauseous, take your nausea medicine 30 minutes before you eat. This may help you keep your meal down. To reduce nausea, eat small, frequent meals throughout the day. Choose dry foods like toast and crackers, and cold or bland food without a strong odor. Be sure to drink plenty of fluids. Avoid high-fat, hot, and spicy foods. Tell your healthcare team if the medicines are not controlling your nausea and vomiting. If you vomit 4 or more times in one day or are unable to keep fluids down, go to the nearest hospital emergency center. Diarrhea and constipation are very common while on chemotherapy. Depending on the type of chemo you receive, you may have one or the other or switch between the two. Tell your healthcare team if you have diarrhea or constipation. Your healthcare team can prescribe medicines to help prevent and manage both. Talk with your healthcare team before you take any over-the-counter medicines. If you have diarrhea, drink at least 8 to 12 glasses or 2 to 3 liters of non-alcoholic, mostly non-caffeinated fluids each day to avoid dehydration. Also, increase your intake of foods high in potassium and sodium. Avoid high-fiber and high-fat foods. The brat diet helps to thicken your stool. This diet includes bananas, rice, applesauce, and toast. Eating these items may help with symptoms of diarrhea. To help with bowel management, over-the-counter medicines are available for both diarrhea and constipation. For diarrhea, if you do not have a fever, take Imodium. Follow the directions on the label. If you do have a fever, talk with your healthcare team before taking Imodium. For constipation, take a laxative, such as Senna or Senecot S, with or without Docusate. Follow the directions on the label for all over-the-counter medicines. Also, follow any specific instructions from your healthcare team. If you take ondansetron, Zofran, for nausea, it may cause constipation. You can take a laxative when you take Zofran. If you're experiencing constipation, some changes in your eating habits may help. Eat meals at the same time each day. Drink lots of fluids and increase your fiber intake. A well-balanced diet with good fiber and fluid intake helps with bowel management. You can find a complete list of foods to include and avoid in your chemotherapy guide. If you have 4 or more loose bowel movements in one day, call your healthcare team. If it is after clinic hours, go to the nearest hospital emergency center. If you are constipated and do not have a bowel movement for 3 or more days, call your healthcare team. Nutrition is very important during chemotherapy. It helps you manage side effects, maintain a healthy weight, maintain muscle, and keeps you hydrated. Your nutritional needs increase during treatment. If you eat as you did before treatment, it may not be enough. So, one of the main goals when patients are undergoing chemotherapy is just to get them to eat. Be sure you're getting good amounts of fruits and vegetables. Also, concentrate on low-fat protein sources such as dairy, meats, fish, and eggs. When you're undergoing treatment, it's not the time to lose weight. Patients who take this approach often end up in trouble because they're unable to control their weight loss and they end up losing too much weight. Malnutrition can become a concern. Also, you may gain weight during chemotherapy. Steroids may cause you to retain fluids, which may lead to weight gain or swelling. Some of the extra weight might be due to the increase in appetite, and that's something your healthcare team and dietitian will have to monitor. A registered dietitian is available to help you. The dietitian can go over your nutritional needs, answer questions, and provide education on nutrition during and after cancer treatment. Your healthcare team can refer you to clinical nutrition. Chemotherapy may cause problems in your mouth. These include soreness and ulcers, infection, changes in your saliva, and in your sense of taste. Start good mouth care right away to help prevent mouth sores. Brush your teeth, gums, and tongue after each meal and at bedtime. Be sure to use a soft toothbrush. After you brush, rinse your mouth with a baking soda solution. Do not use a mouthwash that has alcohol. The goal of nutrition is to prevent any further irritation of the mouth and throat. Tough foods require a lot of chewing. They may cause your mouth to become tired and irritated. Hard and crunchy foods, such as tortilla chips, may scrape the inside of your mouth, which may cause bleeding. It's best if you choose soft, moist, room temperature, and lightly seasoned foods. These are often easy to chew and swallow. For some patients, foods may taste metallic, like cardboard, or have no taste at all. It's best if you use plastic silverware instead of anything metal. Try not to eat foods that come in metal cans. Sometimes that flavoring can seep into the food. Try eating a variety of foods to find what tastes best to you. And drink at least 8 to 12 glasses or 2 to 3 liters of mostly non-caffeinated, non-alcoholic fluids each day. Do not wait until you develop mouth sores to begin good mouth care. To help prevent or lessen mouth sores, rinse your mouth with a baking soda solution at least 3 times a day. Mix half a teaspoon of baking soda with 8 ounces of water. Tell your healthcare team if mouth sores cause problems when you eat or drink. Some chemotherapies cause all body hair to fall out. Other chemotherapies only affect the hair on your head. In general, hair may start to thin or fall out 7 to 21 days after you start chemotherapy. It may start to grow back within a month of finishing chemotherapy. If you have hair loss, there are many options available to you. You can wear wigs, scarves, or hats. It is your decision. You can also contact the American Cancer Society to participate in their Look Good, Feel Better program, a program that helps patients adjust to changes in their appearance. Talk with your healthcare team for more information about these resources. Your fingernails may become brittle or discolored. They may also lift up from the nail bed. To protect your nails, keep your fingernails short. Do not cut your cuticles or get professional manicures or pedicures. Also, wear gloves when you garden or work with your hands. Pay attention to how your nails look. If the skin around them is red or puffy, you may have an infection. Tell your healthcare team if this happens. You may have dry skin. Use an unscented moisturizing cream or lotion. Do not use perfumes or scented soaps. You may also sunburn more easily. Use a sunscreen with SPF 30 or higher when outdoors, even if you do not normally sunburn. You may notice a change in color in your skin. This usually goes away over time. It is common for people on some chemotherapies to have nerve-related side effects. Peripheral neuropathy, a condition that causes tingling, burning, weakness, or numbness in the hands and feet, can occur. If this interferes with your day-to-day activities, such as writing, walking, buttoning a shirt, or using a zipper, tell your healthcare team. You may feel clumsy or have difficulty picking up objects. Peripheral neuropathy may be reversible if it's caught early. You may also feel pain or muscle aches as a result of neurological changes during chemotherapy. Be sure to tell your healthcare team if you have any of these symptoms. Chemo brain is a term used to describe changes in memory, attention, concentration, or other mental abilities. You may experience it as a result from chemotherapy treatment. Talk with your healthcare team about ways to manage chemo brain. Your sexual health may be affected by chemotherapy treatment. Most patients can continue sexual activity during treatment. However, chemo may temporarily decrease your sexual desire. You may also experience side effects such as vaginal dryness or hot flashes. Talk with your healthcare team about this, as they may be able to help. Your ability to have children may be affected. If you think you may want to have children in the future, talk with your healthcare team about fertility before you start chemotherapy. Changes in a woman's menstrual cycle can also occur while on chemo. It is important to talk to your healthcare team about birth control, as chemotherapy may cause birth defects. You may still become pregnant even if you do not have a period. During treatment, men may have trouble getting or maintaining an erection. This usually returns to normal after treatment. Chemo may reduce sperm cell count. This can affect a man's ability to reproduce. It does not affect his ability to have sexual intercourse. Cancer treatment causes major changes in your life. You may feel a wide range of emotions during your cancer journey. It is normal to feel depressed, angry, or fearful during chemotherapy. If you experience any of these emotional changes, tell your healthcare team. They can make the appropriate referrals to social work, support groups, spiritual care, or counseling. Talking about your feelings may help you keep a more positive attitude during treatment. Get support from your family and friends, social work counselor, or chaplain. You may also want to talk with others who are going through the same thing as you. Ask your social work counselor about a cancer support group in your local area. MD Anderson provides several different resources for patients and their families. The Learning Center is a patient education library where you can find helpful information about cancer, treatment, side effects, and other health-related topics. The Learning Center has caring and knowledgeable staff who helps visitors find current and reliable information to answer their medical questions. The Learning Center provides access to medical websites, journals, books, videos, and other resources. The Integrative Medicine Center helps patients who want to combine integrative therapies with their cancer care. Evidence-based programs and clinical services focus on the social, mind, spirit, and physical aspects of health. These include acupuncture, massage, nutritional counseling, yoga, guided imagery, and more. Social work counselors provide free short-term counseling, information on support groups, community resources, and other special programs such as Kiwi, Kids Inquire, We Inform. Kiwi is a program which provides support and education to help children cope with a parent's cancer. Spiritual care and education offer regular chapel services, sacramental ministry, pastoral support, and counseling. Here are a few final tips and resources to help you. To help your appointments run more smoothly, bring the following items with you to all your appointments: your personal calendar to help plan your treatment schedule, a list of all the medicines you're taking, including over-the-counter medicines, supplements, vitamins, or minerals. Include information such as how much and how often you take the medicine, a list of your cancer-related medicines that need to be refilled, such as anti-nausea or pain medicines. Notes about any side effects you may have had and when you had them. It is important for you to know when to get medical attention. Call your healthcare team right away if you have uncontrolled nausea, vomiting, diarrhea, or pain. If it is after clinic hours, go to the nearest hospital emergency center. If you have a fever of 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, with or without signs of infection or uncontrolled bleeding, go directly to the nearest hospital emergency center. Contact your healthcare team if you notice pain, burning, redness, or swelling where you received chemotherapy. If it is after clinic hours, go to the nearest hospital emergency center. Use your best judgment. If you are ever in doubt, get medical attention. Keep the following important information on hand. Your center is open Monday through Friday from 8 a.m. to 5 p.m. If you need help, call your center. If you have an urgent medical issue, call your center. If it is after business hours, during the weekend, or on a holiday, your call will be routed to the operator. The operator will connect you with the Ask MD Anderson clinical team. If it is a medical emergency, call 911 or go to the nearest hospital emergency center. If you are near the Texas Medical Center and can travel safely, go to the MD Anderson Acute Cancer Care Center. It is located in the main building and is open 24 hours every day. You can also send a non-urgent message to your Nurse and Patient Service Coordinator, or PSC, through MyChart. You can expect a response in a couple of business days. Your PSC manages your appointments and scheduling. Be sure to have the following items at home: a digital oral thermometer, Imodium and Synacot, baking soda for oral mouth rinse, your center's contact information, and Ask MD Anderson's phone number, 877-632-6789. If you need a copy of the chemotherapy guide, ask a member of your healthcare team at any MD Anderson location or stop by the Learning Center on Floor 2 of the Mace Clinic or Floor 4 in the main building. The chemotherapy guide is also available in MyChart. Go to the Resources tab and choose Education Documents. Then, type Chemotherapy Guide in the search box and click Search. Scroll down and click on the title to open. We highly recommend you watch the Ambulatory Treatment Center What to Expect video on MyChart or on MD Anderson's YouTube channel, and the video about Kiwi on MD Anderson's YouTube channel. Thank you for watching this video. We hope this video has answered many of your questions about chemotherapy and has given you a better idea of what to expect. You can get more detailed information in the chemotherapy guide. If you have any questions, talk with your healthcare team and always follow their instructions. When you keep the lines of communication open, you take on a more active role in your treatment and care. Thank you for choosing MD Anderson.